So today we're going to talk about blood proteins, the proteins in your blood. I'm going to try to make it extremely simple and basic because there's been a lot of questions about what does high protein or low protein mean in my blood, and also high protein in my urine. What does that mean? Okay. So there's two main types of protein in the blood. Now there's additional ones, but the two main types of protein are number one, albumin, which represents about 50 to 60% of all your protein in your blood, which I'm going to explain what that is in a second. And then antibodies, which is the rest of the protein in your blood, but again, these two types of protein represent most of the protein in your blood. Now, your liver makes albumin, and the purpose of albumin is to hold the fluid in your blood. So if there's liver damage, you're not going to be able to hold the fluid in the blood. So where is it going to go? Now it's going to go out to the urine, but it's also going to go into your tissues around the cells. And we call this edema or swelling in your lower extremities or your legs. It can also go into a sac around your abdominal area, and that's called ascites. Ascites comes from the word that describes a sac that's holding water. And this is why when people have liver damage, they tend to get this pot belly. So, number one, albumin holds the fluid in your blood. Number two, it nourishes your tissues. And number three, it acts as a transport. It helps to transport hormones like your thyroid hormones, electrolytes like calcium, potassium, and sodium, vitamins, certain drugs, and fatty acids. So you can see that protein is really needed for many different functions. Now let's shift gears over to the other type of protein, which are antibodies. Antibodies are produced by certain immune cells, the B cells, that help you in your immunity. So they're little Y-shaped proteins that are like receptors, and they connect with something called an antigen. Now, what is an antigen? An antigen is just simply a piece of a pathogen or some foreign thing in the body that doesn't need to be in the body. So you can look at it like a piece of a virus or a piece of a bacteria. So antibodies connect to antigens and they do four things. Number one, they neutralize it because the danger of a pathogen like a virus is when it invades the cell, it goes underneath the radar and your immune system cannot detect it anymore. So it's very, very important to prevent or neutralize that antigen or virus from entering the cell. So your antibodies will neutralize or get stuck to this virus and kind of leave it out to dry, prevent it from doing anything. Number two, antibodies also tag these pathogens for phagocytosis. So the phagocytes can go in there and eat them. Okay, so they help identify the good guys from the bad guys. And number three, antibodies are involved in inflammation and helping destroy pathogens through using inflammation. And there's a lot more to that in other videos that I've done. And number four, and this is very interesting, if the virus has invaded the cell already, the antibody will cause the infected cell to commit suicide. So as you can see, there's a lot of different strategies going on and the vital importance of this protein in your blood. So if your protein is high, one reason could be an infection. Okay, there's an immune reaction. And now you know a little bit more of what's happening in your body and what it's trying to do. It can also indicate dehydration. It can also indicate there's some type of cancer in the white blood cells, like multiple myeloma. Now, having high or low protein in the blood doesn't mean the same thing's happening in the urine, okay? Because if there's high levels of protein in the urine, that usually means there is kidney damage. Now, there's other reasons as well. I just did a video on that, and I'm going to put a link down below. It could mean that you're consuming too much protein, you did intense exercise, you're taking a certain type of supplement called creatine, but kidney damage is at the top of the list. If the kidney is damaged, then the filter is damaged, and you're not filtering the blood anymore. So you're going to have high protein in the urine, and your urine's going to be foamy. Now, there's something else that's very interesting. When a person consumes excess amounts of water, You can also cause higher levels of protein in the urine as well. And that's not necessarily pathogenic. It's not a kidney problem. It's just you're just drinking too much water. And then, of course, if you're a diabetic, you're going to have higher protein in the urine as well because of the massive destruction of what diabetes does to the filtering unit in your kidney. All right, guys, so thanks for watching, and I hope you now have a greater understanding of blood proteins. Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call, but I put the number down below so you can call and get some help.